This apical four-chamber transthoracic view shows that the apex is aneurysmal in diastole and dyskinetic in systole. This apical three-chamber transthoracic view shows that the basal inferior wall is aneurysmal in diastole and dyskinetic in systole. This apical three-chamber transthoracic view shows that the basal inferior wall is aneurysmal in diastole and dyskinetic in systole. There is a crescentic rind of mural thrombus within the aneurysm. The acute transthoracic echocardiogram is on the left, and 3-month follow-up is on the right. The acute study shows akinesis of the anterior septum, anterior wall, and apex. The follow-up study shows that there has been a recovery and normalization of the systolic function. Parasternal long-axis view. The anterior septum contracts but is hypokinetic. The posterior wall is akinetic. There is tenting at the mitral valve apparatus. The left atrium is enlarged, as is the left ventricular cavity. Apical four-chamber view demonstrating globular or spherical remodeling of the left ventricular cavity. The left atrium is dilated as well. The lateral wall contracts normally, and the septum in its inferior portion is akinetic. There is mitral valve tenting and mitral insufficiency of mild to moderate severity. Zoom view of the mitral valve demonstrating its dome-like tenting. There is only a short coaptation surface remaining. This parasternal long-axis view with color Doppler flow mapping shows that the basal and posterior wall contract well, while the basal and anterior septum are akinetic. There is some tenting of the mitral valve leaflets and mitral insufficiency. The left ventricle and left atrium are both dilated. Parasternal short-axis view at the midventricular level. The inferior wall contracts well. The anterior septum and anterior wall are akinetic, and the anterolateral wall is hypokinetic. Apical four-chamber view demonstrates hypokinesis of the basal inferior septum and akinesis of the distal septum and apex. The left ventricle is dilated in its apical portion. Selective left coronary angiography demonstrates severe disease in the proximal LAD and in the mid-portion of a dominant left circumflex artery. Selective right coronary angiography reveals significant disease of a non-dominant vessel. Two months later, the apical four-chamber view reveals more spherical remodeling of the right ventricle and greater enlargement of the left atrium. The right heart is now enlarged as well. In this segment, color Doppler flow mapping reveals progression of the mitral valve insufficiency, which is due to remodeling. Parasternal long axis view. The anterior septum contracts dynamically. The posterior wall and the basal portion are akinetic. There is distortion of the mitral apparatus with a tenting configuration. Color Doppler flow mapping demonstrates significant mitral insufficiency associated with distortion of the mitral valve apparatus due to LV remodeling.